Hi everyone, welcome back to my channel. My name is Barfin. I'm a doctor of physical therapy and I specialize in cancer and lymphedema rehab. In this video, I will be answering some of the most frequently asked questions about cording. Cording is also known as axillary rib syndrome, and it is actually a relatively common side effect of breast cancer surgery. In fact, it can affect up to 20 to 30% of patients. It is a rope-like structure which resembles a guitar string, and it is mainly located in the armpit region on the same side of the breast cancer surgery. It can sometimes extend down into inner elbow and even into the thumb on the same side, and in some cases it can even extend into the chest. It typically develops a few weeks after the surgery. However, some patients can have it years after as well, and it typically resolves anywhere between 2 to 8 weeks. We still don't know what it is exactly, and there's more research needs to be done in this area, but it is thought that the surgery itself causes trauma to the connective tissue located in the region, leading to inflammation and scarring, especially of the lymphatic vessels that were connected to the lymph nodes that were removed, and that can lead to hardening of the lymphatic vessels, and that results in formation of the cord. Typically, the very first symptom of cording is pain and tightness in the armpit region, and it will also be difficult and painful to lift your arm, especially above shoulder level. Some patients can have either one large cord or multiple smaller ones, but if you try to lift your arm sideways in this direction, you will most likely be able to see the cord or cords if you have multiple ones. However, even if you don't see it, you will most likely feel the pulling and tugging in this position. If your cord extends down into your elbow, it may also be painful and difficult to straighten your elbow all the way. And if it extends down into your chest, it may also be painful and difficult to turn towards your affected side. The biggest and main risk factor for cording is lymph node removal. The more lymph nodes that are removed, the more likely someone can develop cording. However, even if they remove only a few nodes, the risk is still there, even if it's a small risk. But other than that, patients who undergo an extensive surgery, for example, mastectomy over lumpectomy, and those who have lower body mass index, so patients who are skinnier, are more prone to developing cording. There are different ways to get rid of cording. If you have cording, I would highly recommend seeing a physical or occupational therapist who specializes in breast cancer treatment and who has experience treating this condition, so they can evaluate you and create an individualized plan for you to help you with your symptoms. Until you see a specialist, there are mobility and flexibility exercises you can do to soften the cord and help improve your mobility. I have a video where I show 6 effective exercises for cording, and I will link this up here and also down in the caption below. In some cases, heat can also help. However, if you're someone who's at risk for lymphedema, proceed with caution. Prolonged exposure to heat can increase production of lymphatic fluid. Apply heat for about 5 to 10 minutes, no longer than that, and always monitor the area for any signs of swelling. Physical therapy treatment for cording includes manual therapy. This is when your physical therapist will work on the cord tissue. They may massage the cord, and they may also do myofascial release, where they bring your arm out to the side and they pull on the cord, pulling away from the armpit down towards the elbow and thumb in order to stretch and soften the cord itself. And this usually is followed by various stretching and mobility exercises to stretch the cord and improve your range of motion. One product that I use with my patients and find it very effective is Dysum, which is a non-slip material that helps you grip the skin and gives a very effective stretch. And I usually give that to my patients so they can work on the cord tissue at home and effectively stretch it. So these are some of the most common questions I get asked about cording. Thank you for listening. I hope you found it helpful. If you have any other questions about cording, feel free to leave a comment below, or you can directly reach out to me. And don't forget to share this video with someone who was diagnosed with breast cancer so they can also learn about cording, what it is, and what to do if this happens to them. Thank you again for watching, and hope to see you in a different video.